I'd like to talk to you about a very serious, value-sapping epidemic in America. It's professional burnout. It results in unsafe, unprofessional behavior, and it starts the first day of medical school. Our medical education is a system perfectly designed to take pre-med students who have mental health metrics that are superior to other college students, and day by day squeezes the altruism, the empathy, and the idealism out of them until at the end of the education process, half of them are impaired and formally burned out. I like to focus on joy in work instead of burnout. Joy in work is more than just the absence of burnout, and that's what we should aspire to. So I'll share with you an evidence-based, validated, six-piece approach to starting to eradicate professional burnout. But it is begging for more technology solutions. A friend of mine that went to medical school crashed and burned a few years ago. He described his work as getting up in the morning, going to work, loading boxes onto trucks all day long, coming home, having a few drinks, and then going back to work the next day and doing the same thing. That's how he described his physician's work. He left the profession, and he's worse off for it, and so were his patients. So we take these vital pre-med students and we turn them into this, where 54% in the latest survey of thousands of American physicians are cynical, they're callous, they're emotionally exhausted, and they're impaired. They make more medical errors, they have more unprofessional activities, they have more suicidal ideation, they're more likely to leave the profession, and they have lower productivity rates. And so, even though our primary purpose is to take care of patients, we need to put the oxygen mask on first. There are 6 primary buckets of drivers that start in medical school and residencies and go beyond. Most of the drivers are unique to the individual practice, but the 6 buckets relate to the resilience of individuals. And we design much of education with up to an 80-hour work week. 80 hours work week results in a human being that is technically and cognitively impaired to the level of being legally drunk in every US state. The workload is another issue that leads to work-life balance issues. The loss of autonomy or control over your life with $180,000 average debt is another driver. Hostile work environments for students and residents, another driver. Christine Sinsky just published its work in Annals. For every hour that a primary care physician spends with a patient, he or she spends 2 hours in the electronic environment or paper environment doing clerical work. Another big driver of burnout. And of course, meaning and purpose is sapped by those other 5, and it's the 6th bucket when you look at root causes of professional burnout. So we can all define professional burnout the way we want. We can also define, professional burnout has a specific WHO definition. It's a benchmark. You can compare it across the world. Joy doesn't, and well-being doesn't, but I like to look at it as wellness that enables passionate, emotional, and behavioral engagement in one's work and the organization's mission. About 8 years ago, when I was director for quality at Mayo Clinic, the Discovery Channel came to do a documentary on patient safety, and they interviewed Dr. Bob Thema, a surgeon, about some infections reductions he had done for his colorectal surgery, and they saw Iris Krauger down the hallway, and the producer said, let's shoot some B-roll. So they asked Iris what she does at Mayo Clinic. She's a custodian, and she cleans toilets, and she changes bed sheets and sanitizes doorknobs. What did she say she did? She said, my job is to save lives. And she had made the connection between sanitizing the remote control, which has the most bacterial colonies of any surface in our hospital rooms, and saving lives. Iris has joy in work because she has meaning and purpose. She's valued by our comrades, and she feels like she's making a difference, and she is. So the literature basis for looking at joy in work addresses 5 human needs of purpose, community, some control of your life, physical and emotional health, and psychological and physical safety. And we do that with these 6 domains that address those human needs. Most of these don't cost a nickel. They're low tech, and we need your help with technology to scale this and make it work beyond this. So we look at design. So that how we design an organization makes a difference. This Orpheus is a wonderful chamber orchestra in New York City. They don't have a conductor. The musicians rotate that role, and so it's a leader among peers, and that's a model that we use at Mayo Clinic. All of our leaders are physicians. They're all part-time. They all still care for patients, and we partner with administrators. And so that participative management, the us versus them, makes a difference in engagement and joy in work. In medical school, our medical school has used pass-fail grading for decades because in a pass-fail grading system, you're more likely to work with the other medical students, get a social community, and have this camaraderie. If you're on a grading curve, it does just the opposite, and it's a driver of burnout. Got a chance to meet a executive from a very large system in Europe, and she told the story of her son who got glomerulonephritis and then eventually needed a kidney transplant. Everything went well as far as infections and medical errors and readmissions and length of stay, but this is how she described the experience in her own system. And that kindness and empathy actually makes a difference in the outcomes of patients. It actually improves the healing of wounds if you feel loved. No matter whether you follow the protocol, even if you follow the protocols, if you're not loved, your wound doesn't heal as much and you need more narcotics for your pain. And it's reciprocal. This companionate love, empathy, when you train physicians to be more empathetic, retrain them after they lose it in medical school, their patients have better outcomes, their patients have a better experience, and so do the doctors. Leaders make a big difference, and we focus a lot of our energy on 232 physician leaders that we measure every year for their connectedness to the staff and patients they lead. Nick Seibert is a researcher who has a micrometer, and he measured the signature size of Fortune 500 CEOs on hundreds and hundreds of annual reports and looked for a relationship between the size of the signature and the effectiveness of the company. There was a relationship. The bigger the signature, the more likely the company was to have overspent budgets, shrinking market share, and lower margins. So at Mayo Clinic, we hire doctors who have small signature size. We actually measure signature size with a series of 12 questions we ask all 64,000 staff every year about their local leader. We publish this work. For every point on that 60-point scale upward, there's 9% more satisfaction and engagement, joy among the staff, and 3.3% less burnout. Leaders matter, and on this bell curve of 107 leaders that have at least, physician leaders that have at least 10 doctors in their group, that bottom part of the curve, those leaders aren't doing their job. We coach them, we train them, we help them. If they can't move up the curve, we move them out back to doing something they're good at, taking care of patients. Because leaders have a huge impact on patients. Basically, those 12 dimensions are 5 behaviors. 1 is, I appreciate you. 2 is, I communicate transparently with you. 3, I listen to your ideas, and together we will solve the problems. And I take an interest in your career. And the 5th is inclusiveness. So who's this? It's J.K. Rowling. So why do we call her J.K.? We call her J.K. because the publishers of Harry Potter said no teenage boys would buy your book because if we put Joanne in there because they don't like women authors. It starts early. And so inclusion is for all of us to be joyful in work. We all have to feel welcome at work, regardless of what our genome or phenome expresses. Study out of Newcastle, England. What single thing can you do to a cow to increase their milk productivity by 62 gallons of milk a year? Give her a name and use it. So emotional and social intelligence is an important attribute of people in an organization, and particularly for leaders. We measure it in medical school. All of our medical students get an emotional intelligence assessment. All of our staff in their 3-year onboarding before we formally hire them also get an emotional intelligence assessment, not for pass-fail, but to understand that if they are socially and emotionally intelligent, we don't care about the IQ, look at all the benefits. Less burnout, staff is more well-being, they're more productive, they're more satisfied, the team is more effective. So we manage to emotional and social intelligence. We hire to that, and we can always teach the technical if we need it. Second, victims. You've heard about this a little bit. The researchers at Hopkins tell us that the third leading cause of death in America is preventable deaths in hospitals. It's 2 Boeing 47s a day into a mountain. Each of those is a tragedy, and each of those tragedies also has a second victim, and the second victim are the doctors and nurses involved. This is Kimberly Hyatt. She was involved in a medical error with calcium chloride, 1.4 grams instead of 140 milligrams, killed an 8-month-old, and several months later she killed herself. So we have to have a safety net in place for the 400 physicians a year that commit suicide, 1 a day, and we need to have that safety net work with people who are burned out or troubled before they start thinking about that act. Camaraderie is one of the most important drivers of joy in work. This is oxytocin, and this is an MRI showing amygdala without enough oxytocin. You shake someone's hands, your oxytocin levels go up. You get together with a group of docs. We've done 2 randomized controlled trials at Mayo Clinic with physicians as subjects, showing that if you meet a couple times a month for 6 months, your view of the world, of Mayo Clinic, of each other, your social isolation, your emotional exhaustion plummet. If you add food to that, it's called commensality. The research here is done in firefighters predominantly because they make a lot of meals together and they eat a lot of meals together. It makes a difference, so we now pay for meals for as long as any group wants them if they self-form and meet to get together. Looking at the drivers is an important part of this. And so, like we treat our patients, moving from what's the matter to what matters to you, we should do the same thing for our staff. What are the pebbles in your shoes? Good leaders ask that. Good leaders ask, what brings you joy at work, and how can we move together to improve that joy? Roger Resar is a friend of mine who helped when I chaired radiology with a big internal collaborative to improve the reliability of our care. He taught me that process improvement to improve quality for patients is a gateway drug to fulfillment. And so at the end of this 9 months internal collaborative, the group of 80-some colleagues gave him a standing ovation to thank him. We don't do standing ovations at Mayo. But they also rose to their feet because there was so much joy for being part of a team with physicians and physicists and techs and nurses and administrators to improve the reliability of our care for patients. We expect our medical students and residents and staff to have 2 jobs at Mayo. On these 2 slides, there are 43,000 names of colleagues from Mayo who are fellows in our Quality Academy because they see that there are 2 jobs at Mayo, to do your work and to improve your work. And it's part of the secret sauce for improving engagement and joy in work is to get involved in making something better for the mission. One of the projects we had looked at our 22 MR scanners in Rochester. 6 months of lean work, we saved 7 minutes, which is 10 for those scanners is an appointment a day, $4.2 million. And so we're proud of that, but then our CEO, Hugh Smith, said, well, that's not enough. Can you improve on that? And so we did our own exponential work. We went from 1 to 2 extra patients overnight. And then we can't scale it beyond 4, but we did have an exponential curve that started us in that right direction. So the last of these is resilience. And this is one that is extraordinarily important. It's individual resistant. This is all a shared responsibility. It's the one we don't talk about first because this is a systemic opportunity for our country, and we don't want to put it all on the doctor or the nurse or the resident or the medical student saying, it's your problem, do more yoga or eat some granola, because we have to address the leadership and organization issues first. But we have programs, 12 Healthy Habits, that include everything from the usual exercise and diet, mindfulness, laughter, gratitude, forgiveness. We have modules for all those that reach all 64,000 of us online, and we have face-to-face programs to back it up with wellness coaching and opportunities for everybody from secretaries to CEOs to stand at work and move at work. We studied this in radiology. Not only does it have the similar effect to Prozac for mild depression, it actually improved the accuracy rate of CT interpretation. So I'll close there. If you address those human needs, use these 6 dimensions to improve joy in work and eradicate burnout, there are huge dividends for patients. We need your help, though. We need a technology innovation or disruptor to have this go exponential. Thank you very much.